Well, this is kind of troublesome. 4 cases of flesh-eating disease have been reported in Terrebonne just over the past week. One person, one of those 4 cases, sadly died as a result. So this is very concerning. What is going on? How transmissible is it? Dr. Donald VINH is an infectious disease physician, medical microbiologist at the MUHC, the Research Institute, and he joins us now. We're so thankful for your time. I understand you have an emergency, so we have to be quite quick here. Dr. VINH, what do we need to know about flesh-eating disease?
So flesh-eating disease is actually caused by a bacteria that's called group A strep. Some of us have heard of it because it can also cause strep throat. It can also cause skin infections, in kids, something called impetigo, which is like the honey-crusted things in and around the mouth, and in adults, the regular cellulitis. Here, the concern is that this same group A strep is causing flesh-eating disease or necrotizing fasciitis. So you are right; it is concerning. It is actually a pretty gruesome infection that can spread over hours and requires the surgical emergency where we have to take them to the OR, give them antibiotics, and remove dead infected tissue. However, we have to remember one thing, which is that even though group A strep is common, this flesh-eating disease is not. In other words, just because you're exposed to it doesn't necessarily mean you'll get flesh-eating disease. And so there are a variety of reasons why some people get it, and some of it we don't even understand. But I just want to reassure people that it's not that you're going to get in contact with this and then they'll get, flesh-eating disease.
Okay, how is it transmitted?
So group A strep is transmitted by different ways. First of all, it can actually be spread by respiratory secretions. And in fact, this explains why we've been seeing an increase in group A strep infections, because when you have respiratory viruses like flu, and probably the same thing with COVID, people are coughing. After that, it sets up a focus whereby group A strep in some people can complicate the respiratory infections. In other words, it can cause either pneumonia or an infection around the lungs, and those people are coughing, and they can spread group A strep that way to other people. As well, if you have like a wound infection, the fluid from that also will have a group A strep. So people who are having respiratory secretions or who have wound secretions, they can transmit it to other people.
Okay, and what do we need to be on the lookout for? So obviously, if you're having any of those issues, be aware and watch it, but how would you know that you're in trouble?
Yeah, so there's 2 levels of warning here, right? One warning is from the Quebec Public Health Agency to healthcare workers, saying, hey, there's an increase of invasive group A strep, including flesh-eating disease, and therefore these are the things that healthcare workers need to be vigilant about. On the other hand, for the public, right, the public just needs to perhaps, it's still rare, so things that would maybe suggest that there's something going on, and possibly something like a group A strep severe or invasive infection, is first of all, if you have a fever, right? If you have fever and then you have pain out of proportion in a limb, that usually suggests that it's not something benign. So people will think, oh, I have a bit of a pain in my foot or my ankle, maybe I twisted something. They'll take Tylenol. I'm feeling a bit hot. They take their temperature. They have a fever. Fevers don't go along with sprained ankles, right? So if you have things like a fever, if you have redness in the area, if you have a lot of pain, if that redness is spreading quickly, if the person is groggy or you're having trouble staying awake, these are all signs that you're dealing with a very serious infection that needs to be seen immediately.
Okay, so don't take any chances. That discoloration sounds to me like definitely something to be watching out. When you say it's rare, I'm thinking about how when COVID started, we were like 7 cases, 11 cases. It was rare and it quickly wasn't rare. Do people in Terrebonne need to be particularly concerned in taking any precautions?
Well, it's not just Terrebonne, right? It's the entire province of Quebec that has actually noted an increase in these cases of invasive group A strep.
Okay.
And they can occur in children as well as in adults. In adults, the flesh-eating disease is usually what we're talking about now, which is the cases in Terrebonne. It can also occur sometimes in children, but sometimes in children it's a different type of group A strep, like a really bad pneumonia that leads to a bloodstream infection. So there's different kinds of invasive group A strep, and flesh-eating disease is one kind. But to your point, the entire province is seeing an increase now, not just the previous years where, you can argue that COVID was maybe confounding the issue, but in fact even to years prior to that. The increase is slight. It's not a massive increase, but it's still an increase. So this is an issue across the province and not just for Terrebonne.
Okay, Dr. Vin, I have lots more questions, but I know you have to go, and I don't want to hold you up because, the emergency you need to deal with is super important. So thank you so much for your time today. It's much appreciated, as always.
Thank you.